Which side effects are worse at prednisone 20 milligrams and above? Hi, I'm Dr. Megan, the prednisone pharmacist. And if you have to take prednisone 20 milligrams or more, you need to know this list of side effects. And I personally had to take prednisone way more than 20 milligrams. And I experienced a lot of these, but not all of them. And I wanted you to know which ones, according to the medical literature, you can expect. And what's really tricky about telling you what to expect when it comes to prednisone is that it's a super old drug. The company that manufactured it and got FDA approval for it has been out of business for probably as long as I've been alive. And so the research that was done to get it approved by the FDA is super old and incomplete. Between the time it was approved and now, the FDA came out with different guidelines of what studies needed to be completed to get FDA approval. So it was just grandfathered in. And so nobody really ever did studies to say, oh, if you take prednisone 20 milligrams, you can expect this list of side effects. Or you take 10 milligrams, you can expect this list. So what I had to do is gather as much data as possible from the most validated and well-respected sources in medical literature. And I compiled them all together. And then I used what they shared and said, okay, did it say high doses or did it say 20 milligrams and above? And so those are the side effects I'm going to share with you, those that are more common at 20 milligrams and above or higher doses. And the 5 sources I'm referring to that pharmacists and doctors usually have a very expensive paid subscription to include Clinical Pharmacology, UpToDate, Lexicomp, Micromedics, and then the free, anybody can access, FDA-approved package insert product label. So those 5 together, I compiled them all. And so we're going to go through the side effects to expect based on how many of those sources shared that information. So some of those sources shared a lot of information, others only shared a little bit. And they weren't actually the same information. So that's why it's really tricky because some might have shared this information and some might have shared this information, and they don't quite overlap. So what I've got for you is the best I can find because there's no perfect list. Without further ado, here are those that are associated with 5 different medical literature. The first one is fluid retention. This is because of an increased plasma volume, so more fluid, more liquid in your blood, and leg edema, so swelling in your legs. A simple way of saying this is you're retaining water or you're swelling. And prednisone is causing water weight gain. It's mimicking a hormone that your body normally uses to keep the water balance proper in your kidneys, to have the right amount of sodium and potassium in balance. And it's kind of being thrown off because prednisone is mimicking this other hormone. So that's the first one. And that side effect can lead to the next one, which is hypertension, high blood pressure. And it says common on high doses for long term. So the high blood pressure, is it because there's so much more fluid the heart has to pump? Or is it because prednisone is mimicking the naturally occurring hormone cortisol? And normally Mother Nature only makes lots of cortisol when you're in a dire emergency, like a famine or a war. And you need that high blood pressure to have enough blood in your limbs to be able to run away. I don't know which one it is, but that's the second one. And the third is basically lots of ways of saying, I feel crazy. I don't feel like myself upstairs. These are the terms they use. Psychosis, psychotic disorder, schizophrenic reactions, mania, hypomania, hallucinations, and delirium. Those are all possible things that are more likely at higher doses. And at 60 milligrams and above, you have a pretty good risk of mental complications from prednisone. Usually this goes away. It's not permanent. It's just a drug, but it is more likely at 20 milligrams and above. Now, the side effects from 4 sources. This is related to that last one, and it's psychiatric disturbance. Not very clear, like not a clear-cut diagnosis per se, but it's basically I'm disturbed upstairs. My mood is just not the same. I'm not myself, right? And that can lead to severe depression. It says there's a 10% risk of severe depression at high doses. All right, moving on to 3 sources. These are many different terms for cardiovascular disease, heart disease, okay? So I'm going to just read the list of possible heart disease complications of taking 20 milligrams and above. Cardiovascular events, left ventricular rupture, angina, angioplasty, coronary revascularization, stroke, transient ischemic attack, or TIA, cardiomegaly, arrhythmia exacerbation, ECG changes, hypertrophic myopathy, pulmonary edema, cardiovascular death, all-cause mortality. So basically, anything to do with the heart is more likely to get worse the higher the dose you take. Now down to 2 sources, and this is more heart changes. So specifically heart rhythm changes. These are palpitations, arrhythmia, sinus tachycardia, and bradycardia. Anything from faster or slower heart rate or just out of pace heart rate. All right, the next one is the way fat moves on your body when you take prednisone. So this is described as fat abnormalities, redistribution of body fat, truncal obesity, buffalo hump, moon face. Essentially what it's saying is prednisone causes your body to move fat from your limbs, like your arms and your legs, to the middle area, from your face to your belly to the back of your neck as a buffalo hump. And it specifically defines this as dose dependent. So the higher the dose, the worse it is. And it says within 2 months. The next one is high blood sugar or hyperglycemia. Other changes include fasting glucose levels being higher than normal, specifically postprandial fasting glucose levels are higher. It says a relative risk of 10.3 at greater than 30 milligrams. To translate that into English, you basically have a 10 times greater risk of high blood sugar if you're taking prednisone 30 milligrams than if you were to take nothing. That's a lot. The last thing that's with 2 sources is brain fog or amnesia, dementia, memory impairment, just basically being forgetful. You know, all those senior moments that they talk about in all the jokes. It says there's a 1% risk of this. And the last one with 1 source talking about 20 milligram and above side effects. And this is immunosuppression. They're saying that you are more likely to have a weakened immune system at 20 milligrams and above. And that can lead to increased risk of infections like pneumonia, herpes virus coming back. For example, having shingles come back. Like if you got chickenpox as a child, it's more likely to erupt as shingles in very painful rashes. And other possible infections are more likely to come back. One of them is also like a fungal infection in the mouth area or just in general. So if you're suffering these side effects or others and you want to know what you can do about it, I have a prednisone checklist. It includes all of the side effects that you can do something about, the top 15 side effects. And I go through exactly what you can do about it with evidence-based tips from scientific articles, including the doctors who prescribe prednisone the most and the guidelines they've created. I go through what you can do on your own, and then I go through what you can talk to your doctor about doing so that you know precisely how to take the best care of yourself while taking prednisone. Because if you're anything like me and you have no choice but to take prednisone or suffer dire consequences, like I would have bled to death, then you need to download my prednisone checklist. Just click the link below to download it now. Signing off as Dr. Megan, your prednisone pharmacist.